people from all over the United States, from New Zealand, from Beit Sahor. It's really from Canada. It's really quite amazing. My name is Alice Rothschild, and I am on the steering committee of Jewish Voice for Peace, Health Advisory Council. And over 180 folks have registered for this, so we're hoping people continue to join us. It's very, very exciting. I want to welcome everyone to our 11th Jewish Voice for Peace Health and Human Rights webinar. The title is The Responses of Palestinian Leadership to the COVID-19 Pandemic, Successes, Failures, and Looking to the Future. And as many of you may know, we do a webinar every 3 months focusing on health and human rights issues. We're working on our next topic for December, but I don't have it quite nailed down, so I can't tell you what it is. But the reason that we do this is, first of all, we want to provide an up-to-date educational experience on health and human rights issues in Palestine, Israel, often on topics that you won't see in the mainstream media. We also try to link JVP members and friends with professionals and activists locally and internationally, which we can do via Zoom. And after the talk, we provide a forum for Q&A. We also hope to stimulate all of you to become more politically active and to join the Health Advisory Council and help move the work forward. So today we are joined by Fadi Karan, and Sam Brotman is from JVP National is on the call in case of technological meltdown. You will also all receive a survey after this webinar, and we really wish for you to fill it out and give us your comments and suggestions, et cetera, because we actually take this seriously and do read the surveys carefully. This is going to be recorded. And we will be sharing the link with everyone who has signed up. So the way it's going to work is I'll introduce Fadi. He'll talk for 30 minutes while he's talking, and then during the Q&A, please write your questions on the chat box. I will curate the questions during the Q&A for Fadi, and then we'll have a little bit of a wrap up. So we're currently up to 57 people, so that's super. Anyone who has escaped Zoom meetings up until this time, the chat box is located at the bottom of your screen. You have to hover and it will come up and you click on it and then you can type in your questions. We're also asking everyone to stay muted so there's no background noise and dogs barking, et cetera, et cetera. Okay, so let us begin officially. So Fadi Karan, who I have met several years ago in Palestine, is the campaign director at Avaz, a 60 million person strong global movement mobilizing for change. He leads Avaz counter-disinformation efforts, which, as you can imagine, are really needed at this point in our history, with a focus on investigating influence operations and pushing for social media accountability. He also leads efforts on building transformative leadership across the Middle East and North Africa, supporting human rights struggles across the world, and ensuring accountability for war crimes. And he does community organizing in Palestine. He's a very busy guy. Fadi is also an entrepreneur in the alternative energy field, where he has founded 2 companies bringing wind and solar energy to Palestine and other countries in the region. Fadi has appeared in the New York Times, NPR, The Guardian, Time Magazine, The Daily Telegraph, and other media outlets. And you can follow him on Twitter at Fadi Karan. So Fadi, why don't you take it away? I'm going to mute myself and I'll give you a 5-minute warning when your 30 minutes is getting close.
Thank you so much, Alice, for the introduction. And thank you everyone for being on this call. It's always a pleasure to be speaking with JVP members, because it kind of reminds me of the joint struggle we all have together to make this world a better place, even in the darkest of times. And what I'm going to do in this presentation is really speak to the topic of leadership and COVID-19 with what's happening today in Palestine. But I'm going to try to do it as a story to make it a bit more engaging. So I'm also going to try and keep it short, because I think that the juice here will come from any questions that the audience may have. And I'd love to have a conversation about this. And to give you a little bit of background, for the last, when I started just out of college, becoming a community organizer in Palestine And with the kind of Arab Spring and everything that came out of that, and then we organized the kind of protest to achieve unity in Palestine between the different political parties. We organized nonviolent protests. For example, the protest that came in 2011 from Syria and Lebanon and other places where refugees tried to return home, attempts to enter into Jerusalem. And throughout that period, what had continuously happened was that the Palestinian Authority would play a key role in disrupting those efforts on the ground. And the big question for me was, what seemed to be lacking is that a lot of the leadership in Palestine that currently existed, those who were at the height of power, just were not delivering for the people. And at the lower levels, you had a lot of grassroots leaders, wonderful young men and women and others who were doing their best, but they were consistently, apart from being oppressed by the Israelis and the Palestinian Authority, unable to create the transformative change needed on the ground. And so I began from that time just studying leadership, and particularly leadership in the Palestinian context. And this is where I come to this presentation. I want to kind of be very clear that I'm not a biologist or epidemiologist. I'm not an expert in kind of COVID-19. I'm more an expert in the leadership response and the political response to COVID-19. That's more of what I've been studying as part of this longer trajectory of thinking about what leadership is needed in Palestine and across the Middle East to be more transformative and to create a social contract where everyone has freedom, justice, and dignity. So kind of with that as background, let me start with the story of, if we look just a month before the pandemic started, before COVID-19 reached the Middle East and reached particularly Palestine and Israel, what was the situation on the ground? Let's start from there. Number one, you had the Palestinian Doctors Union. Doctors across the West Bank and Gaza were on strike. And one of the main reasons they were on strike was because of the lack of the Palestinian Authority's investment in the medical sector, and because of the lack of specific rights that were given to them. A key quote from the leader of the Palestinian Doctors Union, just a week before the pandemic hit Bethlehem, he said that we're protesting because if the situation continues the way it is, the Palestinian medical sector will completely collapse. And that was before the pandemic hit. At the same time, a lot of money, if you look at the Palestinian economy, you had, again, before the pandemic, an unemployment rate that was across the West Bank and Gaza hovering at about 26%. And the economy was in decline largely because of a bunch of reasons, the occupation being the main one, of course. A number I always like to reference is that, so people understand the consequences of the occupation, is that if the occupation allowed Palestinians access to the natural resources that they have just in Area C in the West Bank, that would be 1.5 times more than all of the money we as Palestinians get in international aid. So you can understand just the scale of how much the occupation is pillaging literally yearly of Palestinian GDP on that front. But the economy was in collapse. Yet a lot of the investment, a lot of the money that was coming in terms of funding, if you were kind of sitting on top of Palestine, seeing how all the money is being funneled across society, the chunk of it, about 27% was going through the security sector. And where we got to here is, and this is a funny story, the Palestinian security sector is consistently looking for projects to get more money. And of course, they are very controlled by certain actors. It was the US to a large extent, of course, and the Israelis. One interesting thing is that at the time, it was kind of reported by Dr. Tahani Mustafa, who wrote her PhD on the Palestinian security forces, that the Palestinian security forces, their soldiers, were not allowed to watch Invictus, the movie about Nelson Mandela and the kind of South African rugby team. If anyone's watched it, raise your hand if you've watched Invictus. So this is just a story about Nelson Mandela and kind of what he did as part of the kind of post being elected as president to unite society, but actually it was decided that the Palestinian security forces won't be allowed to watch that movie because it may make them compare their situation to the apartheid situation. So they were not allowed to do that, but the Palestinian security forces were always given money when what they were going to do was something that would defend the Israeli government's interest and the Israeli government's security. And in this case, a very smart young man managed to convince the kind of security apparatus leadership, and then the Americans and Brits and those funding it, that it would be useful to give the Palestinians training in how to deal with the outbreak of an epidemic. And that happened in 2019 in the summer. And they were like, yes, actually, let's allow the Palestinian security forces to do a simulation about how they would deal with an outbreak of the MERS virus, the essential Middle East respiratory virus. And they got some money and they began kind of doing simulations about how they would deal with this epidemic. And of course, a big part of the simulation, a lot of it was useful for them to do that a year ahead. For those in the US, you'll hear that, for example, the Obama administration did a number of simulations and had the team in the White House as part of the National Security Council that was focused on simulating what an outbreak would look like in the US and how to deal with it, that the Trump administration dropped. In Palestine, fortunately, such a simulation happened a year before COVID arrived. The good thing was that, so there was some type of blueprint in terms of, because that was done, and it was funded because it would benefit the Israelis, because if there was an outbreak and the Palestinian security forces managed to deal with it, then that would be good for Israel, which would also benefit from not being hit by the outbreak. So all that said, where this story leads is that tourists, it's still not fully clear, but it appears that they were either Italian or Greek tourists that were visiting the Holy Land, Bethlehem, arrived in the city, and a few of them were carrying the virus. And so the coronavirus began to spread in the city. Because the simulation was done in 2019, one of the key conclusions that was reached was that the Palestinian health sector is in shambles. So even a minor outbreak could mean utter collapse. And the other conclusion that was reached was that because of how the occupation was controlling the movement of Palestinian society, and because Palestinian movement largely intersected in some places with the movement of Israeli settlers, that the virus would easily spread if there was an outbreak in area A, it would easily spread into Israel. So those were some of the two biggest conclusions. And then the third conclusion from that simulation in 2019 was that we need to act fast, we need to act decisively, and we need to act militarily in a securitized formula. And this is where things began to get interesting, right? Because if you look at the US response to the outbreak, or if you look at the, for example, Italian response or any global response, you could tell whether the response was largely medical and health focused led, or whether it was led by security forces, and whether it was more kind of an authoritarian kind of putting your hand down on society. But regardless, what I would say is that fortunately, because the Palestinian leadership got this update, because the simulation in 2019 said the amount of ventilators was less than 300 across the West Bank and Gaza, what would need to happen is a quick shutdown. And that's in fact what happened. So early March, Prime Minister Shtaya decides, looks at the data. He's actually advised by the World Health Organization, based on internal conversations, you don't need to shut down and clamp down fully. This was kind of, you need to maybe shut down local areas and begin to kind of quarantine where the infection is. But Prime Minister Shtaya, having the details from the simulation in 2019, knowing how they had not invested in the healthcare sector, you would assume if there was a prime minister and a healthy government that put the interests of the people first, that you see that an outbreak of an epidemic, because the health sector was so weak in Palestine, could lead to significant harm. What you would do is you would begin investing more in your health sector to make it ready. That never happened, unfortunately. Instead, what happened was we'll need to enforce a more securitized, let's say, push pressure on the Palestinian people. But the truth is, Prime Minister Shtayyeh announced shutdowns in March. The Palestinian people, in a kind of collective way, as those shutdowns began being announced, as many of you who have family or friends there know, there was a significant amount of just trust and actually admiration that such a strong step was taken by the government very quickly, especially as people began to see how the outbreak had escalated and the curve had skyrocketed in countries like Italy and the US and elsewhere. So people were proud, and the Palestinian society largely maintained a level of cohesion, respecting the rules. But one thing also became clear in terms of the weakness of the Palestinian leadership. They could enforce those rules. They could enforce social distancing, quarantining, staying at home for 14 days in Area A. But you had a lot of Palestinians that were working in settlements or working within the Green Line. And what that meant was that although the PA could enforce these rules locally, you still had the first kind of wave of the outbreak escalated, even though the outbreak that happened in Bethlehem due to tourism was kind of controlled and dealt with effectively. The outbreak began to slowly spread because of these workers. And the PA tried to work with the Israeli side to say, let's make sure that the workers' return is organized. Let's make sure that it is a kind of done in a safe way. There are images that show that, in fact, Israeli soldiers did the exact opposite and began opening the borders even further in certain places, opening parts of the wall so that the workers could return to their villages without any of the precautions that needed to be taken. So the PA's leadership here was largely, in the first part, was largely effective because they were honest. They followed the basic rules that one should follow at the beginning of a pandemic. Clear communication, explain to people the severity of the situation, explain to them what you know, and demand that people come together and shut down, follow the rules. That was done effectively. The second point that was done effectively is close down or quarantine the areas that have the spread. And that's what happened in Bethlehem. But slowly, because the PA lacked full control over the West Bank, what we began to see is that with the workers from the Green Line returning, there was a spike in COVID. And on the other hand, society began to slowly, in the first 2 months, after the kind of surprise trust in Prime Minister Shtayyeh and the excellent initial response to this problem, people began to see the gaps. One of the key gaps was that there were Palestinians many were stuck abroad. We don't control our borders, but there were many Palestinians, students mainly, that were stuck abroad. And you can imagine an 18-year-old, 19-year-old student on a scholarship in the UK. The UK completely shut down. Or someone working on leave in Turkey, for example, and not being able to find food. There were young women from Gaza stuck in Malaysia that were studying there. Malaysia shut down, they had nowhere to go. The PA's response on bringing them back, we saw a lot of officials or families of officials being flown back, some through Tel Aviv, some through Jordan, but we saw kind of no real mobilization to return the people that were most vulnerable and in need of return. So that created, people said there's something fishy here. Are we back to cronyism? And then the kind of second challenge that came was that there was what we would call kind of, in Arabic it was waqf al-'izz, but it was kind of a fund that was created, like a steadfastness fund, that where kind of rich Palestinians, those running companies like Paltel and others, were asked to donate to this fund that would help the poorest in society. And what happened was initially people were, everyone loved the idea that you have those most well-off putting money in a fund to serve those least well-off. Well, what happened was that a lot of complaints began arising that the way the PA was distributing that money was largely based on cronyism, some tribalism, some connection to Fatah and the ruling party, and not based on actual need. A lot of complaints began coming out. And then last but not least, in terms of this process, people saw that the PA's response, instead of actually investing more in health, instead of framing the doctors and nurses and others that society needs, and teachers and other servants that society really needs to deal with this problem effectively, instead of giving them more resources, the PA continued to prioritize the security forces and continued to respond to the challenge of COVID-19, not from a full collective societal approach, but from a securitized approach of having soldiers in the streets, Palestinian security forces in the streets. They even established checkpoints that they called checkpoints of love to distinguish them from the checkpoints that Israel had formed. But in many cases, some of those checkpoints or closures that happened, because they were not organized, led to significant injuries, just like Israeli checkpoints would lead to, where people would need to get to the hospital and wouldn't be able to get there in time. So the story of leadership, from having this very early strong response, begins to devolve into what the kind of PLO and what the PA has become. And this is the key question, which is a body that does not represent the interests of Palestinian societies at large, but represents the interests of a number of actors, a number of the political elite, and that puts the maintenance of the status quo ahead of improvement for society at large. And what happens there, if we're telling this as a story, is you have this moment of kind of initial high trust in society. Palestinians, everyone's coming together to deal with this virus. That trust begins to collapse. And as that trust begins to collapse, a lot of local groups, and this is where the excellent leadership arises, a lot of local groups began to take the situation into their own hands. So you would see youth groups in different villages, seeing that the PA wasn't actually protecting and providing welfare and care to the people most in need. You would see local youth coming together to collect money to then give to those in need. You would see local community organizations, including those connected to Fatah, but also those connected to Hamas and others, and just kind of city halls beginning to put money together to give to the least well-off in society, to give to the poor. And so the response goes, the initial response was largely led by the prime minister with a kind of core group of advisors that included the governors. It begins to devolve into where each governor can make their decision based on their governorate, Ramallah, Hebron, and so forth. And then actually it devolves where the real response, not the just media, who's talking to the media, who's giving the press conference, but the real response on the ground is being held by the Palestinian community, by those communities at large. But at the same time as that's happening, there are two dangerous scenarios. The first is, due to the lack of trust of the PA, less and less people began to actually abide by the rules, such as social distancing, staying 6 feet away. And because the economy is so weak, a lot of people their savings began to run out. For many people, the savings already had begun to run out the summer of last year, largely because the US and others had cut funding. And so the PA wasn't consistently, and Israel had imposed, kind of held back certain Palestinian tax money that was owed to the Palestinian people. So a big chunk of society was already living off of their savings. The savings began to end. Less and less people began abiding by the basic rules. And this is where we began to see over the summer, the wave of the virus begins to rise up again. And where we had up until, I would say, May, the cases were in the hundreds. It was a big deal if you would announce kind of 6 new cases in one location, such as the Colombia refugee camp. That was like headline news, 6 new cases. Now we're at a point, as this trust was lost and as the PA began to fumble in its response, because their key goal in how they responded to COVID was not protecting society. It was, how do we maintain control over the status quo? One of the key things that was shown in the simulation in 2019 was that any failure by the PA to maintain the status quo would probably lead to local rioting or protests or uprising by the Palestinian people against the PA because of the high levels of inequality. And essentially the PA wanted to, through its securitized effort, avoid that at all costs. And where we are today, though, is that now in the summer, as the cases began to rise again, a lot of people began protesting corruption within the PA, or protesting on the COVID-19 response, or protesting the lack of basic healthcare provided to people, or protesting corruption within hospitals where appointees are decided by the PA, not based on merit, but based on connections. And the Palestinian Authority, and where journalists were beginning to cover these problems more. And what that led to was the PA beginning to crack down. The PA started arresting journalists who criticized it online. And then it moved to whenever there was a protest being planned. And because the PA announced an emergency law, they're using the emergency law to, instead of clamp down on the virus, to clamp down on their own people in terms of ensuring that there are no local protests on that front. And here's the problem now. The virus is on the rise. In the last month, in September, we went from what we had in the summer, a few cases per day, to up to 1,000 cases per day. We went from deaths that could be counted with double digits to right now we have 350 deaths, and we have an outbreak as well in Gaza, where the response in Gaza, initially Gaza was locked down, so it didn't get the virus early on, but there was an outbreak just that started last month, and now we have about 850 cases in Gaza and 17 deaths. But there's big fears here, both in the West Bank and Gaza, that actually the numbers do not reflect what's actually happening on the ground. And this deserves to be studied. The problem is there are no independent actors who have the kind of tools. In the US, let's say you have the CDC, and then you have, who is now unfortunately being politicized significantly, as you all know. But you also have the University of Washington, you have Johns Hopkins, you have a number of other actors where even if the CDC becomes politically influenced by certain actors, there are other means to measure what's happening. In Palestine, a lot of that is just in the hands of the PA. And you have a lot of Palestinians in society. I've been speaking to a lot today before this call to just test. And you have a lot of people who believe they have the virus, but are afraid to report it because they fear that if they report it and then they're quarantined or sent to a hospital, their chances of surviving in a hospital are less than their chances of surviving at home. And there's also now the stigma of having COVID-19, that many who are kind of less educated and who, because the PA in its response kind of destroyed or hit hard on that sense of collectiveness in dealing with the virus, created a type of individualistic approach to it, are just afraid to act in a way that's to the benefit. So people will stay home, but not a lot will go to the hospital. And you have the of course, threat of disinformation, where there's just a lot of rumors flying around on Facebook and social media, God knows from where. But it's hugely problematic because there's no kind of corrections. There's no effort to correct those lies. So where do we get with this mix? We also, some of the, I would say, blame needs to also be put on culture a little bit here, because we love weddings as Palestinians. And one of the main reasons that the kind of outbreak sped up over the summer was because people began doing weddings again, despite advice not to do them. And so a big reason for doing those weddings is just that it's cultural. The wedding is needed to happen at a specific time during the summer if it's planned. A lot of people had small weddings. I'm not blaming everyone who had the wedding, but there were a few big weddings that happened that were responsible for the spread of viruses. And one interesting case here that shows you how the weakness of the PA and the occupation together mixed to create disaster. One of the key weddings that pushed the spread of the virus happened in a place called Kufr Aqab. Kufr Aqab and Ar-Ram. I'm sure many of you have been near the Qalandia checkpoint. Raise your hand if you know where, or you have seen the Qalandia checkpoint. Yeah, a bunch of people know where that is. It's one of the key checkpoints between Ramallah and Jerusalem. But in that area between Ramallah and Jerusalem, it's part of Jerusalem, Kufr Aqab, and they're supposed to be part of the Jerusalem municipality borders, but it's kind of like a no man's land. The Jerusalem municipality doesn't really care about that area. They don't provide basic services. And because it's considered Area C, the Palestinian Authority also can't serve there. And in some of those areas, that's where you see a lot of crime, For example, a lot of people build buildings without the proper kind of permits because nobody's watching what's happening. Or you have many drug dealers who go and stay there because the PA can't enforce the law and Israel doesn't care to enforce the law because it's largely Palestinian communities. Israel wants to push them away from Jerusalem, wants to redefine the borders. So those Palestinian communities are not part of Jerusalem. So where were a lot of the weddings happening, where nobody could enforce the kind of quarantine social distancing, they were happening in that no man's land, in that area that couldn't be enforced. And that also sped up the disaster of COVID-19. So we're at a place today where the virus is spreading. We're now averaging about 500 cases per day. There have been 50,000 cases. And if you think about the numbers, if you look at, we were supposed to have gotten more ventilators, but I think in total now there are probably 600 ventilators, the last number I saw, up from 300, but 600 ventilators in the West Bank and Gaza for the size of this population that's nearing 6 million is, as you guys are aware, is definitely not enough. And this is the difficulty today then, is if you look out, now that you have seen some of the details on the ground.
Five minutes, Fadi.
Yeah, thank you, Alice. So I'll end here, which is to step back. How could the Palestinian leadership have acted differently with COVID-19? 5 specific points. I will begin with point number 1, which is invest in health, invest in education, invest in the key things that your society needs, instead of putting the largest chunk of your GDP, which equals all the money you're putting in health, education, the agricultural sector, and science all together. Put more money in health to improve the health sector and do that early. The second step would have been, if you had an excellent Palestinian leadership, is think of the collective and think about how you can transform society through this COVID in messaging and approaches that do not distinguish and allow priority for elites in society, but actually give the priority and serve those least well-off in society. If the PA had designed a system that would have done that, it would have built a deeper sense of trust, a deeper safety net across society that would have allowed for the transformation needed. And then the third point would have been, during COVID-19, instead of trying to maintain the status quo through a securitized, oppressive approach of shutting people in their homes, of putting security forces in the streets, of arresting people who criticize your approach, the PA could have transformed the status quo and used COVID as a moment to unite the Palestinian people across the West Bank and Gaza, and to begin moving towards creative means of rebuilding our economic infrastructure based on things such as giving people money to, everyone was staying home, giving people money to plant your land. If people could go in this moment where we were also facing the threat of annexation, remember, imagine if the PA had invested in giving every Palestinian a number of olive trees to plant homes around their villages and near them. What would that have meant? That would have meant that as people were stuck, not being able to do anything, they could have been fighting the occupation, maintaining land that Israel wants to seize. And in doing that, the PA could have shifted this moment from one of being a victim and just asking for foreign money to be able to maintain the status quo. It would have used that moment to transform what our economy and resilience looks like. And last but not least, what the PA could have done if we had excellent leadership is leaders create a vision for the future. And in times of dire need, in times of darkness, it's up to a leader to not just explain to people how they're going to deal with this darkness, how they're going to deal with this plague, but to build a vision for what comes next, for what we're going to build after, for the society we want to create. And that's a key part of healthy communication during disasters, during crises, is you give people something to build for. And the PA failed to do that, of course. It didn't give people a vision, and that allowed society to kind of devolve into every grouping for itself, trying to survive, instead of everyone working together towards something larger. If the PA had taken those 5 steps, it would have been a completely different situation, and we would have probably seen a kind of revolutionary transformation in what Palestinian society looked like, and much less COVID-19 cases. Because by investing in health, by creating a vision, by giving people, those least well off who needed jobs, who went back to work because they needed to feed themselves, less people would have went out to the street, and trust would have maintained so that people would follow the advice that was given, and that would have saved lives. So I will end there. I know there was kind of a lot of data, but I hope this was a useful summary, and I'll do my best to answer any questions that you guys have.
Well, thank you, thank you. That was really wonderful. So can you hear me now? Yes, okay. So thank you so much. That was really wonderful. People should put questions you have in the chat. And I should also let you know that the Health Advisory Council puts out a weekly timeline on COVID-19 in Palestine and Israel. And it's located on jvphealth.com or .org, either one. So if you want up-to-date, what's happening every week, it's all located on our website. So I don't see any questions yet, so I have a couple of questions for you. You had mentioned you had written a journal article on this topic, or an article on this topic. Is that something you could share the link with us?
Yes, I'll put it in the chat right now.
Okay. So another question is, when the practice for a pandemic happened, what got in the way of the Palestinian Authority and the medical community preparing the obvious things that they needed to prepare to deal with a potential pandemic? What were the forces that kept it stuck in its old ways?
That's a great question. And I would love to actually ask the leadership that question myself. Because to be frank, I don't have all the answers, but I can tell you the assumptions based on the research that I've done, why they didn't act on a solution like this. The first reason is that the PA as a body is not designed to function for the best benefit of the Palestinian people. This is an issue of structure. The PA was designed in the Oslo agreements, as many of you know, to largely serve as an administrative body that serves the continuation of the occupation. The assumption, of course, of the leadership was that it would serve for 5 years to create the basis for a state, but that collapsed in 1999. And so the existing structures of the PA then meant that, A, you didn't have the people with the merit. There's a huge issue of skill here. You didn't have people with merit who were capable of taking the findings of that epidemic study, of that simulation, and turning it into a full health-based response. And then even if you had a few people with merit within the PA, based on the structure that existed to do that, if they were to come and say, we're going to shift right now our whole budget of the government to take money away from the security forces, because we don't want them to take money. Number one, the PA is bloated and you have hundreds of thousands of people working as employees right now, many of whom are not doing anything, but still you have a big chunk of those, about 100,000, I think is the latest number, that are in the security forces. And so someone comes and says, we're going to take money away from the security forces and put it in health. They're just going to be red lines. The red lines will start from probably the Israelis, who will say that if you do this, you're in trouble. But also will start from kind of leaders within the PA themselves that rely on these security forces to maintain the dictatorship that we have. Let's remember, President Mahmoud Abbas has been in power now for over 10 years without any kind of electoral democratic mandate to be there. And so he needs those security forces to maintain the kind of power balance that exists. Last but not least, you have foreign powers, particularly the donors, and the way the donors decide in terms of where money goes in Palestinian society. Is money given to UNRWA? Is money given to invest in this sector? The donors can have huge leverage in deciding how money for health and other topics go. And so you can't have, because we're not a free country, unfortunately, you can't have something like the Affordable Care Act coming in Palestine with like a full sovereign mandate from a leader that says, we're going to create this new system for the people to benefit the people. they have to jump through a number of loopholes. The last assumption I would make is that the Palestinian leadership is now busy in this whole debate focused on how do they stay in power. Their main goal right now is the peace process as an illusion has collapsed. And President Mahmoud Abbas feels like he's losing trust. And in fact, polls show that 66% of Palestinians believe he should resign or he should leave. And so the whole kind of system exists today. The way the PA is focused, their mind, their eyesight is just focused on staying in power, not focused on any of these bigger solutions, such as taking the lessons from that simulation and implementing it. Because let's be frank, there's that simulation. This is just one example. There are 1,000,001 things that can and need to be done by, if we had excellent leadership, they would do, starting from democratic elections, moving towards improving the social security system that exists locally, moving towards protecting Area C and investing monies. It's not just about responding to COVID. There are dozens of things that could be done if the PA leadership had the vision and the responsibility and the skill to do it. They just don't. They're focused on staying in power. And I think that's the core reason why none of these things are being implemented as they should.
Wow, okay. There's a question about testing and how tests are acquired and who's providing them and who gets them and who doesn't want them. And do you have any information on the whole testing issue? Because that's how you figure out how many cases you are and how to quarantine people and all that kind of stuff.
Yeah, I can speak to some extent about that, and I'll share links that give you more details. Because as I said, I'm not an expert in the kind of details about testing. What I do know is that the World Health Organization, as a main actor, and some other donors, China, for example, have donated the swabs and the testing kits and so forth. So there are a bunch of them. People can go and get tested through the Ministry of Health. That changed. Initially, there was a limited amount of tests, so only those who had or felt they had symptoms would go get tested, would be allowed to get tested, and the PA would choose kind of very specifically on a very specific set of standards who would get the test and who wouldn't. But now my understanding is because of the kind of support from the World Health Organization and the support from China and a few other governments that have donated testing kits, anyone who wants to get tested can go and get tested. In fact, anyone returning to Palestine has to get tested. And then you have, if you're returning, you have a 14-day quarantine where you can't leave your house, even if the test results are negative. Now, where we are kind of today in terms of those tests and why people are taking them or not is another question. I don't know what the average amount of tests the PA does per day. I can share that number with you. I know it fluctuated. At a certain point, they were doing up to kind of 2,000 to 3,000 tests per day, which is not bad, for the size of Palestine. I don't know if they're still at that level or if it's gone down in recent days. There's a question, of course, about and this is global, not just Palestine, but how accurate these tests are. There's a question about, there were a lot of stories of people who got tested, got negative results, and then got tested again and got positive results. But I think we're seeing that globally, so I don't want to just put the blame on the PA. The thing is, though, I'll give you kind of an anecdotal story. One of my friends had to go get tested. And so he went to the hospital in Ramallah, and he went and stood in line. A lot of the people that were there were not standing in line, were not social distancing, and were not wearing masks. And then he went into the room, and even some of the kind of nurses and doctors, one of the doctors who was organizing the lines wasn't wearing a mask, which was by its own a bad sign. And then one doctor or nurse, I don't know if it was a doctor or nurse that was running the tests in the hospital, because there were a lot of people and people were getting antsy and nobody wants to be in line for a long time, assuming that other people around them are sick, and the place wasn't fully clean. So the nurse began running the tests without changing the kind of gloves or doing the relevant steps that you need to take between test and test. So you can imagine that's an anecdotal story. I want to be fair and say that, You know, I've heard a couple of other stories like that, but it may not be the case all the time. It may be just one bad hour. We have to be fair. But you can imagine, though, for Palestinians who have been, the story about some Palestinian hospitals, such as Ramallah Hospital, is that people go there to die. You know, some hospitals are called the Butchery because people are just afraid of how bad they are and how bad the service is. And so and it's not the doctors or the hospital's fault. The doctors are overworked. The hospitals don't have the resources because of PA policies. But you can imagine if you're like, you know, like my grandmother, you know, who is now in the US, but you can imagine if she was in Palestine, 85 years old, and she heard and she knows how bad the hospitals are in terms of hygiene from past experiences before the COVID-19 started. Would any sane person make a decision to go to one of those hospitals or to get tested at those hospitals? To a large extent, people would say, "Oh, I'll try to survive this myself, but only at the last moment will I go to hospitals or will I get tested." And the other challenge here is that because there has been rumors about the reliability of testing, a lot of people just don't even trust the test results. So they'll say, you know, I'm not going to get tested. I'll just stay living day to day. And last but not least, because of the kind of collapse of trust, you have people who need resources. This is another big thing. You have families that will go hungry, that may starve if they don't go to work. And so those young men, you know, imagine being 21 years old, having 2 kids, and your parents and needing to provide for them. A lot of them will just decide to go to work, even if they're not feeling great, because they feel the virus isn't that dangerous, and because it's actually an existential threat for them not to work. And so those kind of factors come in where you have less and less people wanting to get tested, and less people trusting the testing process. And you know, again, I'm giving kind of the bad case scenario. The good side of things is that people do, for the large part across Palestine, care about care about their communities, about the collective. We've learned from the intifadas, we've learned from living in the occupation, from living under curfew for months and months, how to come together in times of need. And so people are very caring, and that's the real safety net, right? The real safety net is on a local level. People know that they won't go hungry. They can ask their neighbor or they can ask a member of their family, and they will kind of feed them. And people do not want to hurt their neighbors and communities. This is one of the weird things I've seen in the US, where kind of ideological, kind of the whole pandemic has been politicized. So, you know, for example, in the South, you see people not wanting to wear masks, not caring about that. You know, it's kind of very individualistic about my freedom, and I can wear a mask and I shouldn't wear a mask and so forth. In Palestine, there's a little bit less about that because society is more collective. And so people will definitely take care if they're in areas where they feel they're around vulnerable people. And I think that's one of the key factors that's preventing this virus from getting worse, is although the government response is not excellent, the local response is based on a healthy collective insight where people may do things that will harm them personally, such as, you know, going to work when they're sick, but they'll make sure while they're working that they're not exchanging or putting anyone else at threat on that front. So it's kind of a nuanced concept, but I wanted to put that out there as well.
Isn't the testing situation very different in Gaza? I mean, in terms of availability and access?
Yeah. I mean, in Gaza, to my understanding, is that in the last period, particularly the last month, there has been work across international organizations with the PA and the de facto government, the Hamas government in Gaza, to bring in kind of more testing. And my understanding right now is that there is enough testing. It's worth looking into. You're right, though, Alice.
Yeah, I don't think there is. Yeah.
Yeah, but my understanding is that 2 to 3 weeks ago, there was a big kind of shortage and there wasn't enough testing on that front, but that's being fulfilled as we speak. But we can double check that and share with the group here.
Okay. And how did the PA's stopping coordination with Israel, I don't know how much it has really stopped, affect funds available to combat COVID-19?
That's a good question, and I would say so far, specifically funds in terms of combating COVID-19, I don't think that has been affected, but it has affected funding going to the Palestinian government at large, and this has affected people's wages in terms of whether people are being paid their full wages or not, and that's, you know, I think one thing that was a problem in terms of how people looked at COVID was not seeing COVID as a holistic threat, and connecting it initially to the economy, connecting it to kind of cultural, social factors, and so forth. But I think all of us can imagine what it would feel like if, in the midst of this crisis, a person lost 50 or up to 70% of their income. And we can imagine a big source of liquidity into the Palestinian economy is the money that comes from kind of taxes, a lot of which, you know, Israel has withheld a big chunk of, and comes from foreign donations. And we know Arab governments' funding for the PA has decreased significantly. We've seen all the kind of normalization and problems that are happening now. International donor money has also decreased, largely because the US has cut funding, but also, you know, the world economy is not in its best place. And what that means is that the economy gets worse. And when the economy gets worse, dealing with COVID gets worse. So even if money that goes to like more testing or money that goes to buying a few more ventilators is still there, the lack of liquidity and money across society in a holistic way still creates threats, because that will limit the amount of people that decide to get medical care, for example. That would limit how well people can maintain hygiene. That would limit whether people feel comfortable, if they're sick, going to work or not going to work. And I think that's where the big impact has come. And that's where kind of the cutting of ties and coordination with the Israeli security forces has led to that harm. But there's also a question here, which is, to what extent has this coordination collapsed? You know, again, the PA states that there's no coordination anymore, but for many on the street, it feels like to some extent there is, at some level, coordination between the actors, even if it's happening through a third party. I hope that answers that question.
Yes, so thank you. Unfortunately, there are more questions, but we're coming to the end of our hour. So I really want to thank you. This was a really a wonderful discussion of some very challenging and difficult issues. We didn't touch on the refugees and differences in Gaza and so many other things that need to be talked about. So just thank you, thank you, thank you. Sort of in conclusion, folks, I just want to remind you that this is a JVP Health Advisory Council webinar. We do have a webpage, jvphealth.org, where you can get up-to-date weekly information about COVID-19 and Israel-Palestine. We also have a monthly media watch where we curate all the new and interesting things that have happened on health and human rights over the past month. Our group also does advocacy, attends meetings, writes pieces, writes things for journals. We do all sorts of stuff, and we would really love for people to join us. And you can sign up on our website if you want to do that. So I thank you very much. And we do have a survey that you will receive, and I really hope that everyone fills it out so we can see what you think and what other topics or suggestions you might have for the future. I think we have 3 minutes. You want to have the last word, Fadi?
Yeah, I would say one thing that I do want to say about Gaza specifically is that largely the kind of lack of leadership in the West Bank of the PA reflects itself also with Hamas. You see a lot of the same challenges. But centrally, Gaza, because it's been under siege for so long, apart from the healthcare sector there being so much worse, also people's immunity is so much worse, like people's actual daily health. You have malnutrition, particularly amongst children. And so the virus in Gaza spreading is, I would say, 10 times more dangerous than it's spreading in the West Bank, just because of the consequences that the siege has had on people's health conditions to start with. And I want to say, kind of to end on a hopeful kind of point, which is, I do feel that COVID-19 and what we're facing today across the world is going to be a moment of a crisis-opportunity, essentially, a crisis and an opportunity. We can react to it from a place of fear, from a place of worry, from a place of frustration, and kind of feel demobilized, frozen by it. Or we can think about how we turn these dangers and create the world that most of us everywhere want to see, a world based on freedom, justice, and dignity for all. And I want to end this by encouraging everyone, after that bleak kind of outlook on what leadership looks like today, leadership is not one person, leadership can be all of us. So let's all rise to the occasion and continue to fight for that world from wherever we are, because we can be the transformation that we see missing elsewhere. And I'll end there.
Well, that is a very wonderful way to end, because you can get very depressed when you think about all of the things that are going on in our world right now. So thank you so much for the positive message, the honest message. There's so much more to talk about. Thank you, thank you, thank you. And I hope you can get back to your home and not get stuck in the United States along with other Palestinians. That would probably be good for you. So thank you, everyone. Please take the survey, and thank you for coming.